Imagine a world where every public health decision is backed by rock-solid data, where governments don't just hope their policies work, but know they're saving lives. Sounds ideal, right? But here's the twist. Achieving this requires dismantling outdated systems, bridging bureaucratic silos, and redefining how we share information. And this is the part most people miss. Data isn't just a tool. It's the heartbeat of modern public health. Yet, as Anne Zink and Jeffrey Schiff, two former chief medical officers turned policy pioneers, reveal, the journey to data-driven success is riddled with challenges, debates, and a few surprises. Dr. Anne Zink, a former Alaska CMO, now working with the Pew Charitable Trusts, and Dr. Jeffrey Schiff, a Medicaid CMO for Minnesota, are leading a mission to create a national blueprint for data partnerships. Their work isn't just about numbers, it's about lives. Consider this, just 5% of Medicaid recipients account for half of all costs. That's a staggering statistic, but it's also a call to action. By integrating Medicaid and public health data, states can spot trends, target resources, and save billions. But how? Let's unpack their insights. From ERs to policy, a tale of two physicians. Zink and Schiff's paths to public health were anything but linear. Zink, raised by two doctors, was drawn to medicine by its ability to blend science with the human experience. Schiff, inspired by his nurse mother, found his calling in pediatrics, only to realize that the ER was a front-row seat to the real-world impacts of flawed policies. The ER is where you see health policy in action, Schiff explains. One bad decision and a child's life spirals. That's why I got into policy. The CMO experience, breaking silos, building systems. When Zink became Alaska's CMO during the pandemic, she overhauled the public health department, splitting it into two because complex care patients, those with chronic, overlapping health issues, needed a system that treated them as whole humans, not just medical files. Schiff, who left his CMO role before the pandemic, focused on Medicaid innovation. He emphasizes trust. If you don't build relationships with communities and lawmakers, your policies will fail. Both agree, clinical expertise in government isn't just helpful, it's transformative. Data as the new currency. Their current work with Pew aims to create a universal framework for data sharing across states. The goal? To turn raw data into actionable insights. Data is the secret sauce, Zink says. But here's where it gets controversial. Many argue that data privacy and ethical use are under-addressed. Schiff counters, perfect data is a myth. We act with what we have and refine as we go. Yet critics might ask, can we trust governments to handle sensitive health data responsibly? That's a debate worth having. The cost-benefit conundrum. States often face budget constraints, so why invest in data partnerships? Schiff compares it to RD. Medicaid and public health spend less on data than corporations do on marketing. It's a no-brainer. Take Washington State's $32 million savings from smarter ER protocols. A win for both patients and taxpayers. But Zink warns, technology and policies evolve fast. Today's blueprint could be tomorrow's relic. Misconceptions and hope. One big myth, that governments already have perfect data. Zink laughs. Clinicians are often shocked by how little information they actually access. Meanwhile, Schiff finds hope in ethical principles. Healthcare's core values, do no harm, justice, align perfectly with data-driven reforms. Yet a lingering question remains. Is the US ready to unify its fragmented health system, or will politics and bureaucracy stall progress? As Zink and Schiff continue their work, they invite us to rethink data's role in public health. Do you agree that we should act on the data we have now, even if it's not perfect? Share your thoughts below, because the future of health policy might hinge on this very debate.